Welcome to a new series interviewing business owners in Orange County. My name is Ian Phillips. Today I'm joined with Dr. Jihan Ansari, and together with her husband, they're running a membership-based practice, bypassing insurance, making healthcare more affordable. We all know health insurance has gotten outrageous over the last decade, it feels like. So today I want to talk to her about her business, what she provides, and maybe who it might benefit. So please.
Yeah, thanks, Ian, for reaching out and, wanting to get to know me as a small business owner.
Yeah.
We're both in South Orange County, so I think it's just so important to make connections. But, so my husband and I are two physicians, and about 2.5 years ago, I started Harbor Direct Primary Care in Laguna Hills, California, and it is a bit of a different model of care. It's called Direct Primary Care, meaning that patients actually pay a membership, a monthly membership, which is a low membership, $100 a month for adults and $50 for kids. And what they get with that is basically all access care to their doctor. So 30 to 60 minute visits, no wait times, no crowded waiting room, and just that direct access. They can actually text us directly.
Only $100 a month?
Yep, $100 a month.
So what would someone get with that? Because I know a lot of people pay hundreds, or I've heard of $1,000 a month for some health insurance.
Yeah.
So the $100 a month membership versus the $500 a month health insurance, what is, are you bridging the gap between what you might get with health insurance?
Right.
Or?
So we're not a replacement for health insurance, but what we aim to do is cut out the middleman completely so that we can actually treat our patients the way that, kind of old-fashioned medicine, spending time with patients. We really only work for our patients. And so in doing so, we're really able to include all their visits in the membership fee. So you're probably used to paying a copay to see a doctor, or even a surprise bill after maybe getting a procedure done at your doctor's office. So at our office, it's just the membership fee, and there's never a copay or surprise bill.
Interesting. And if you've probably seen her on TikTok, she's been blowing up over the last couple of weeks. But I know you talk a lot about why someone would want to choose the membership-based practice. Do you think it's for employees? Is it for business owners? What type of person is that?
Yeah, I actually kind of think it's for everybody who just wants better access to their doctor and just to feel heard and to be able to have time with their doctor. Health insurance these days has just become so expensive and unaffordable for so many people. And health insurance is not health care. It's really important to have for the big things, but for things like primary care, preventative care, we're actually finding that it is cheaper to go outside of insurance for things like primary care. And so that's what we're offering to our patients, so that the goal is you really don't use your deductible much with our practice unless something really big happens where you probably will already reach your deductible. Does that make sense?
Right. So something like surgeries, you'd
Right.
go with health insurance, of course. But standard visits, I think you've talked about hormone replacement therapy as an option, as something that you might provide in the future.
Yeah, so we do lots of stuff at Harbor. We do hormone replacement therapy for men and women. We do mental health treatment, so depression, anxiety treatment. We also do more lifestyle counseling. I'm also board certified in lifestyle medicine, so I'm able, if I were at a fee-for-service practice, I wouldn't get paid for lifestyle medicine, which is basically helping patients with lifestyle changes to either treat or prevent chronic diseases.
Wow.
So we're kind of just able to practice the way we want, and then patients get the care that they want.
And with that $100 a month, what are you available 24/7 to talk to the person? How many visits does that include?
Yeah.
As an example, if someone needs to get an MRI done, is that something that you provide? What are the costs for that?
Yeah. So obviously we need our sleep. We've got our families. We're not necessarily 24/7 doctors. But what I usually tell my patients is you can always text me. Even if it is late at night, I will get back to you the next day, whether it's like a medication refill or, doctor, I think I'm getting a UTI. That way we can deal with it first thing in the morning. Keep you out of the urgent care, because urgent cares can also be really pricey, right? And then in terms of needing something like an MRI, yes, we order all of those things. So whether it's like your screening mammograms, colonoscopies, CT scan, MRI, either if you do have insurance and want to go through insurance, you can use that option. Otherwise, we have very affordable cash options. So $250, $300 for a CT scan.
And what would something like that cost going through insurance?
So I recently had a patient who needed a knee MRI, and her insurance was charging her $1,000, and through our practice it was $300.
Wow.
So she just decided, I'm not even going to go through my insurance because I haven't met my deductible yet.
Huh. Interesting. So for someone who maybe doesn't go to the doctor that often, they could get like a basic health insurance plan and then subsidize that through your membership.
Exactly. So I think the key is having something for backup in case something catastrophic happens, but usually those higher deductible plans are going to be cheaper monthly.
Right.
And then you pair that with a direct primary care membership where you're getting this high quality of care because we have time for our patients. You can actually get a hold of your doctor. And so it's great for, your wallet, but also your sanity, and not having to, wait on hold for hours, then wait weeks for your doctor, and then, wait an hour in the waiting room. Nothing like that here.
Wow. And what made you and your husband decide to start a practice like this? Because I'd never heard of it until I saw you uploading videos talking about it.
Yeah, well, it's actually, there's been doctors doing this all over the country for, I think, like 15 years. But it's definitely growing in California, and we wanted to open a private practice. We weren't really happy working for like a large corporation. And so we started to look into different methods, and both of us didn't want to deal with insurance because that's why most doctors don't go into private practice. And I had a friend from residency who started a DPC in the Central Valley, and he was really successful, and he helped us out. And then I met other people in Southern California who've done it, other doctors, and they helped us out. And we just kind of started. And just kind of took a leap of faith, and it's worked out.
And when did you get started?
We opened officially July 2023, and I started it up by myself because I didn't have any patients at that point. So then when we were more stable with a patient panel, that's when Dr. Pedro, my husband, joined the practice full-time in March this year.
Oh, nice. That's so cool. And I want to talk a little bit about health insurance as a whole. I know I myself don't exactly know how it works, and I'm sure a lot of people watching also don't know how it works. They just know that they pay a large amount of money every month, and they still somehow have to pay when they get services provided to them.
Exactly. And I think that's the problem. I mean, even as a physician, I've had to learn so much about health insurance. I didn't learn it in medical school, and so now not, taking insurance and having to help my patients navigate that new model of care, I had to become, more knowledgeable on it. So basically, the way health insurance works is that you choose a plan where you're paying a monthly premium every month. That's sort of like a Netflix subscription. So whether you use it or not, you are paying your monthly premium. And then on top of that, you have what's called a deductible, meaning that you will have to pay out of pocket up until a certain amount, which is usually in, either the high hundreds or thousands, depending on the plan. And you basically have to pay out of pocket until you reach your deductible. So you have your premium monthly, plus needing to work up to a deductible, which can be in the thousands, especially for a family. I've heard families paying $2,500 a month just for their premium.
Oh my goodness.
Right. So what patients don't realize is they do not need that, platinum plan. They do not need the most, the highest plan, because that doesn't always guarantee that you're going to get access, right? So what most of our patients do is they get a plan that they can afford on top of the membership. Yeah,
I mean, to me, that sounds like the future of of healthcare, I think. Because, I mean, health insurance has been going up almost every single year, it feels like. And I don't foresee an end to that over the next decade.
Yeah, I mean, I think the problem is, like, this year at least, premiums are going up again.
Yeah.
And part of the problem is that there are so many uninsured people, and so that's why the health insurance is raising their prices. But I think what that should tell health insurance is that your system's not working, and that's why people aren't insured. I mean, they want to be insured, they just can't afford it, right?
Yeah.
So I think there needs to be better options for people who are going to take care of their primary care and be lower risk overall because they're taking care of themselves, they're getting their, prevention and seeing a doctor regularly. Well, then they don't need, such a fancy insurance plan.
Do you think this works for families as well? Like if you have, because I know that is a enormous cost for families who have maybe 2 or 3 kids and whose health insurance for the whole family might be $2,500 a month. Is there options for them to get into this membership service and then reduce their overall health insurance costs? Is that, or are you thinking this is more for maybe like a couple or someone who's single?
I think it can be for everyone. We have several families. Parents want peace of mind when, their child has a fever or a rash. They want to be able to actually get in touch with a doctor. And that's what that's what we're able to offer them. And yes, more families are just opting for those cheaper plans. There's also something called a health share. I don't know if you've heard of health shares. So health shares is kind of more of that high deductible plan that is approved through the ACA for health insurance. And what it is it's a more affordable option for families. Where
is it like Medi-Cal or?
Nope, no, it is usually there are some faith-based health shares, but there's also faith-based health shares. It's basically you're agreeing to pay whatever you can afford via your deductible, and they will cover you for the big things. And they will even reimburse you for some wellness, like your annual exam. And the cool thing is a lot of health shares are now pairing with direct primary cares and saying, if you're enrolled in a DPC membership, you get $100 off a month, which basically will pay for your DPC membership.
And for someone who doesn't know what DPC membership is.
So that's what we're
direct
doing.
Primary care, I'm guessing.
Direct primary care membership. So it's $100 a month through our practice. So you would basically be getting that reimbursed.
So for someone who's on the health share, this is at no cost, essentially.
Essentially, because it gets taken out of their, I believe it's their deductible amount.
Is health share government based?
Nope.
It's private?
Yeah.
Okay. Just like a health insurance company.
Exactly.
Interesting. And then what about the people who are on something like Medi-Cal in California?
We have a lot of Medi-Cal patients as well where they're qualifying for Medi-Cal, so they're not really paying for health insurance, but they do make an income and they're able to afford $100 a month. And so they're coming to us for their primary care. And I think a lot of things about what we try to do is really keep our patients healthy so that we're just lowering your risk of chronic diseases in the future, lowering your risk of being, a burden to the system by keeping you healthier and keeping you out of the hospital.
How often do your patients, I don't know if visit or reach out is the right word? Because for $100 a month, I would say that's one of the most affordable health plans, health care options that I've heard of.
Yeah.
Are they reaching out very often? Is it keeping you pretty busy?
I think it's kind of like a mutual respect, right?
Yeah.
Between us and our patients. There are certain times where someone will be going through something like, an acute infection, recovering from surgery, where they do have to be seen more often. But then we may not see them for a few months. And so it sort of balances out.
Right. That makes sense. And for I don't know if the average person is the right word, but for a lot of people, they don't really use the health insurance programs that they pay for. They're, maybe going to the doctor once or twice a year, just doing the average checkup. And there are circumstances where it's not necessarily a surgery, but larger expenses that they would need that health insurance for, and it sort of meets their deductible. for someone who maybe needs to pay, let's say their deductible is $5,000 a year as an example, and they're sometimes hitting that, would it be more beneficial to stay within that health insurance, or maybe you offer similar things that would be more affordable for that person?
I think it depends on the patient, because some people do have chronic diseases where they really need specialized medications that would cost them thousands of dollars a month. So in that case, staying on the plan that works best for them would probably be a good option. But then actually having us as their primary care doctor to kind of be like their home base, right? To talk to their specialists, to make sure that they have their refills when they need it, that they're keeping up on their preventative exams. Because I think a lot of people don't usually see their primary care doctor more than once a year these days.
Yeah.
Even though
I don't even think I've gone this year.
Come on now. Maybe you will after this. Yeah. So I think it's very personalized. It really just depends on the patient and their health status and their health needs.
Yeah.
But we try to help patients as much as we can. We have an insurance agent that we work with that can help them find a plan that works for them.
For the average health insurance payer, are there services that, if someone comes to you and says, I might need this, are there some things that you just can't provide besides surgeries?
Yeah, I mean, that's a good question. So obviously we're not specialists. So sometimes there comes a point where somebody does need to go see a cardiologist or a neurologist. In that sense, I think it's helpful having us because we know a lot of the local specialists. We can call them directly. And then also we offer telehealth specialists. So if someone maybe is uninsured, for instance, because we do have a lot of uninsured patients, we can offer like a $50 telehealth specialist consult. And they would probably otherwise not be able to get that.
Interesting. Wow. Is there an average age range that is in your practice, or is it a wide variety?
I don't have the exact numbers, but I've got a little of everything. I have some kids and some Medicare patients. I would say the majority of our patients are families, though, maybe in their 40s and 50s with some kids.
Right, maybe in their 40s. Okay. And I want to talk a little bit about TikTok, because that's where I found you. I think when I found you a couple of weeks ago, you had like 2,000 followers, and now you're at 15,000 or 16,000 or something, whatever you're at now. Have you gotten a lot of people reaching out from it?
Yes, it's been kind of crazy. Yeah. I mean, I'm not really in the TikTok generation. I was on Facebook in college, and then, Instagram was the thing, and I was sort of always like intimidated by TikTok.
Right.
And I've had an account for a couple years now, but I don't post on it that frequently. And then, the day that I just decided to kind of sit at my desk and talk about what direct primary care was and how we bypass insurance and you don't even need insurance for our practice, that just created like this big buzz. And, I was happy to just get the word out there. I have doctors in other cities telling me that, a patient signed up for their practice because of this, doctor they saw in Laguna on TikTok. Wow. So, hey, I mean, I'm happy. I mean, I wasn't expecting that, but TikTok has been a great tool. Yeah. Definitely.
No, I think TikTok's really good for, I use it a lot for just watching talking videos, like educating myself on maybe what's going on versus other platforms. So I've been watching all your videos.
I mean, you're not doing too bad yourself. You're doing great on TikTok, and I think your videos are really effective too. And it's just like the sitting, talking, and you can be organic, and I like that.
Yeah, I agree.
Mm-hmm. Yeah.
All right. Well, I think that's all the questions I have for you.
Okay, well, I mean, thanks for having me.
Yeah, thank you so much for joining.
I'm always happy to talk about direct primary care. And
Great. I'm going to tag all her information below, and be sure to follow her on TikTok and reach out if you're looking for a direct primary care.